You will see health benefits by reducing your alcohol consumption.
A new guideline is urging Canadians to reduce their alcohol consumption. Researchers say less is more when it comes to your health. The new report from the Canadian Centre for Substance Use and Addiction suggests a person should consume no more than 2 drinks per week to mitigate health risks. This is down from the previous recommendation of 2 drinks per day. Dr. Kevin Shields says 7 out of 10 Canadians who drink currently consume more than 2 drinks per week.
We know it's not realistic that everyone can meet this 1 to 2 drinks per week because there's various social pressures and people are used to drinking much more than that. So for those people, I would recommend that try cutting down by a little bit and see how that affects your health.
The CCSA says the new advice comes from thousands of studies that link alcohol to several types of cancer, including breast, colon, and liver. The report says there is moderate risk for those who consume between 3 and 6 standard drinks a week, but consuming 7 or more per week is dangerous. Dr. Shields says the main carcinogenic component of alcohol is ethanol itself.
So that means your cancer risk is the same if you have a drink of beer, wine, or spirits. It all causes cancer to an equal extent. And that ethanol can actually directly damage the DNA, and that's how it causes most cancers.
The CCSA is calling for mandatory warning labels on alcohol containers and bottles, but the alcohol industry is pushing back, arguing it's voluntarily informing people to drink responsibly, so there's no need for labels. However, legal expert Jacob Shelley from Western University says these warnings should already be in place.
We ought to normalize industries providing consumers with the information they need to make informed choices. So buyer beware, caveat emptor, presumes that buyers are aware. And so the industry has an obligation to inform consumers.
Without the warning labels in place, Shelley says Canadians don't have all the information.
There's long been an idea of responsible drinking, drink responsibly, but it's hard to be responsible if you don't know the actual risks.
The Bruce Oak Recovery Centre in Winnipeg has been providing help to those suffering from drug and alcohol addiction since May of 2021. Executive Director Greg Kylo says 37% of the people that they treat at the long-term facility are dealing with alcohol addictions.
It has been consistently significant, and especially with certain populations, it's even more prevalent. And so I think not looking at the harms caused by alcohol is something for all of us to consider.
Dr. Shields says merely reducing alcohol consumption will improve overall health.
Keep with it as well, because those health benefits are real and you should be noticing them when you cut back.
In Winnipeg, Alex Karpa, City News.